Good morning, sir. I am Dr. Haripriya. I have some questions regarding snake bite. Can you please clarify my questions?
Good morning, Dr. Harpriya. My name is Dr. Sevanvesh, consultant critical care physician, James Hospital, Ragolu, Srikakulam. Please go ahead with your questions.
Sir, in India, our state AP is standing second in snake bite. Till date from Jan, there are 1050 cases reported in our Srikakulam district, where our medical college stands. So, can you please tell me how many types of poisonous snakes exist in our state, Andhra Pradesh?
There are majorly two varieties of venomous snakes, neurotoxic varieties in this Indian cobra and common kite snakes, and the hemotoxic varieties in this Russell's viper, Saskel viper, and humped nose pit viper snakes are present. Neurotoxic snakes usually affect the nervous system in the body. It leads to paralysis and finally leads to respiratory failure, and they will die because of respiratory failure. For hemotoxic snakes, this venom affect the hematological system, then blood will not clot, that leads to continuous bleeding into the different organs, finally leads to multi-organ failure and death.
Sir, can you please explain how to provide first aid, how to transport and assess the patient in emergency department?
First, when a snake bites a person, first we should lie down the patient and give reassurance and see that he does not make any movements and he moves, lymphatic system gets activated and venom spreads faster. Then clean the wound with soap water, note down the time and draw a circle around the bite so doctors can identify the wound easily. Now I will tell you things which should not be done. Sucking out poison, applying very tight tourniquet, cutting the wound, inducing electric burns and applying turmeric powder. Now before going to the first aid, we have to call ambulance and please do remember, do not waste time trying to catch or kill the snake. As per our demographic area, we have only 4 poisonous snakes for which we have cure. Now we go into two scenarios. One is snake bite on foot and other on hand. Now I will show you how to apply a proper tourniquet. Now we have two subjects, one is bite on hand and one on foot. Now if the bite is on hand, ensure all jewelry is removed, and for foot if any tight clothing is present, loosen the clothing and now gently lay them on the floor. Now we clean the wound and applying primary bandage. Now we completed primary bandage. Now we are applying secondary bandage with splint. Splint can be wooden stick or whatever you can fetch at the location. Now we completed secondary bandage. We have to ensure that the bandage is not too tight. To do that, we have to insert one finger below the bandage and should be able to pass the finger at least 1 centimeter. Now we tie the hand to the body to achieve complete immobilization until we shift the patient to the hospital. Now we are applying splint with bandage to the leg. After completion of bandage, you should press the toe for 3 seconds to check for blood flow and ensure that blood supply is not occluded due to your bandage. When the patient comes to emergency, we have to assess first whether he is protecting airway or not. For that, we should ask him to ask his name or anything. Then if he is speaking well, then he is protecting his airway. Then followed by breathing. Breathing, we should connect to the all monitors and we should observe saturation and respiratory movements doing well or not. Then for circulation, and we should check the pulse rate and heart rate on the ECG rhythm, and we will check the blood pressure. Then for snake envenomation, then we should check the local signs of bark. For local toxicity, we will examine for bite marks. During that bite marks, we will look for any local swelling and local rise of temperature, any redness, and we should check how much local swelling is extended. Then systemic envenomation features, we should look for any neurological signs like ptosis or neuromuscular paralysis. For that, we should ask single breath count. Then we should ask the patient count from 1 to 30. If this is less than 10, then he is going to impending respiratory failure. For that, we need to intubate and initiate invasive mechanical ventilation. For hemotoxic snake bites, we should draw the blood and when doing the whole blood clotting time. If it is more than 20 minutes, then it is a hemotoxic snake bite. Then we should start the anti-snake venom immediately. Now I will show you How do you test the single breath count on the patient? Take the deep breath and count the numbers.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
You have observed here. That means if 12 means his vital capacity is very less than 30, he may require intubation and invasive mechanical ventilation, or closely we have to monitor this patient, or repeat again single breath hold. If this is less than 10, definitely he may require intubation and invasive mechanical ventilation.
Sir, how does the venom spreads in our body? What is the peak time it takes to manifest clinical symptoms, and what is the golden hour?
As soon as snake bite, around 15 to 20 minutes, venom starts spreading through the lymphatic system. Again, 35 to 45 minutes, it will spread to the whole body. After that, 2 to 2.5 hours, onset of symptoms and signs of envenomation, it will start. Followed by 4 to 6 hours, it will go to the peak stage. That's why golden hour of envenomation is the first 4 hours. So, if you reach the hospital, have anti-snake venom, your chances of survival will be very high.
Sir, do you need to bring the snake along with the patient to the hospital, sir?
No need. In our demographic area, majorly there are 4 poisonous snakes are available, for which only one polyvalent anti-snake venom is available. As this one polyvalent anti-snake venom acts on all the 4 snake venoms.
Sir, what are the signs and symptoms of snake envenomation?
We classify patients into 3 groups. Mild variety, that means only local swelling and pain without progression. Moderate envenomation, that means swelling and pain or ecchymosis progress beyond the site of injury, and mild systemic or laboratory manifestation. Severe envenomation, that means marked local response and severe systemic finding and significant alteration in laboratory findings. Coming to neurotoxic snakes, we have 2Ps and 5Ds. 2P is ptosis and paralysis. Ptosis is the first neuroparalytic symptom. 5Ds are dyspnea, dysphonia, dysarthria, diplopia, and dysphagia. Signs and symptoms of hemotoxic snake bites are bleeding gums, epistaxis, conjunctival hemorrhages, petechial hemorrhages, hematuria, prolonged whole blood clotting time, that means more than 20 minutes, abdominal pain, vomiting, diarrhea, shock, and multi-organ dysfunction syndrome, and finally leads to death. Now we discuss systemic signs and symptoms of envenomation. Local symptoms of envenomation are local swelling and pain, tenderness, and local rise of temperature, and followed by rapidly progression of local swelling that leads to cellulitis and compartment syndrome, and finally leads to gangrene.
Sir, what is anti-snake venom? How do you administer it? What is the route? What is the dose and its complication?
Before going into the details of anti-snake venom, I would like to clarify difference between the venom and poison. Venom is directly introduced into the body through a bite. Poison is going to the body either by surface absorption or ingestion. There are 2 ways of giving anti-snake venom. Another is push method, another is IV slow infusion method. In push method, anti-snake venom overall this 100 ml will give over 20 minutes. In a slow infusion method, anti-snake venom we will dilute in 0.9% or 5% dextrose 250 ml. Then we will give over 90 to 120 minutes. From these 4 poisonous snakes, venom was extracted, and this venom was introduced into the horse blood. Again, this horse blood was recollected, antibodies were separated from this horse blood, and finally polyvalent anti-snake venom was prepared. Each box of anti-snake venom contains a total of 10 vials. After reconstitution of each vial contains 10 ml of anti-snake venom. So 1 ml of anti-snake venom neutralizes 0.4 to 0.6 mg of snake venom. Coming to Indian cobra, fatal dose of Indian cobra is around 12 milligrams. Per bite, on an average 60 milligrams of venom introduced into the body. 1 ml of anti-snake venom neutralizes 0.6 mg of venom. So to neutralize 60 milligrams of snake venom, we need 100 ml of anti-snake venom. It is equivalent to 10 vials. Coming to common crate, fatal dose of common crate is around 6 milligrams. Per each bite, on an average 20 milligrams of venom introduced into the body. 1 ml of anti-snake venom neutralizes 0.45 mg of venom. So to neutralize this 40 milligrams of snake venom, we need to give 100 ml of anti-snake venom, which is equivalent to 10 vials. Coming to Russell's viper, fatal dose of Russell's viper is around 15 milligrams. Per each bite, average venom introduced into the body around 63 milligrams. 1 ml of anti-snake venom neutralizes 0.6 milligrams of venom. So to neutralize this 63 milligrams, we need 100 ml of anti-snake venom, which is equivalent to 10 vials. Coming to saw-scaled viper, fatal dose of saw-scaled viper is around 8 milligrams. Per each bite, average venom introduced into the body around 13 to 40 milligrams. 1 ml of anti-snake venom neutralizes 0.45 mg of venom. So to neutralize this 40 milligrams, we need to give 40 to 50 ml of anti-snake venom, which is equivalent to 5 vials. Around 20% of patients receiving anti-snake venom, they will get allergic reactions to this anti-snake venom. During that time, immediately we will stop the anti-snake venom. Then we will give immediately 0.2 to 0.3 mg of adrenaline subcutaneously, 1 in 1000 dilution. Then we will give injection 200 mg of hydrocortisone and 1 vial of Evil. Again, after subside of allergic symptoms, again we will restart the anti-snake venom because we have no other option to any other to replace the anti-snake venom. Again, for children and pregnant women, we have to give same dose of anti-snake venom because same amount of poison it is injected into the body after snake bite.
Sir, what are the other treatment options available for snake envenomation apart from anti-snake venom?
Apart from ASV, there are other supportive treatment measures. These are all tetanus toxoid and prophylactic antibiotics to prevent infection. For neurotoxic snake bites, we will give, apart from ASV, neostigmine plus atropine. For hemotoxic snake bites, after anti-snake venom, patient continues to be coagulopathy, then we have to give FFP or cryoprecipitate. For acute kidney injury, we have support with dialysis support and cytosorb therapy. In case patient has a respiratory failure secondary to different causes, we will provide ventilatory support. If patient has shock, we will give fluid resuscitation along with vasopressor supportive therapy. For compartment syndrome, we will give fasciotomy. If progress to other changes, necrosis, then leads to amputation, and plastic surgery services also we will provide.
Sir, why do snake bites are more in villages, that too in rainy seasons?
Snakes don't hunt humans because they are afraid of humans. They live by two ways: hunting to live and protecting themselves. Snakes are small, they cannot eat humans. Snakes choose how much venom to introduce during a bite: moderate, severe, or dry bite. If venom gets fully exhausted, it takes 2 weeks to reproduce venom. Meanwhile, during this period, they can't eat because they can't kill prey to eat. During summer, they lay the eggs. During winter, they hatch the eggs. During rainy season, these eggs break and baby snakes are come out. They are more hungry, active, and hunt fiercely during rainy season. In villages, there is a vast land of farms where plenty of rats and frogs are available to eat them. Coming to village houses which are poorly ventilated, there are many huts which contain many gaps. So through gaps, snakes easily enter into the huts. Snakes move more in dark places, so these villagers are more likely to get exposed to the snake bite.
Sir, what are the precautions to prevent snake bite?
In villages, there are more number of huts along with more gaps. For that, we need to closure of gaps with cloths. And those people who are sleeping on the floor should use mosquito nets. And people who are going to farmlands, should they use torchlight, and they should wear gumboots and they should wear hand gloves. In villages, those people living in the houses should maintain hygienic measures like keeping shoe racks neatly arranged and waste cloths neatly folded. Keep good illumination of dark areas. This way, we can prevent snake bite.
Thank you, sir, for enlightening us regarding about snake bite protocols and treatment.
Thank you.